Hello viewers and welcome to the DM Health News Update. Under the program, Your Health, Your Wealth. Medical experts are sounding the alarm on a critical yet often overlooked connection between heart health and male sexual function. Renowned urologists have emphasized that men with cardiovascular conditions, including hypertension and heart failure, are at a significant higher risk of experiencing sexual dysfunction, particularly erectile dysfunction. Our health correspondent reports on the intricate relationship between the heart and sexual well-being. The ability to achieve and sustain an erection is directly linked to healthy blood circulation. According to leading urologists, when the arteries supplying blood to the penis are compromised, whether due to hypertension, coronary artery disease, or heart failure, men may experience erectile dysfunction. Speaking exclusively to print media, consultant urologist Dr. Emmanuel Leze underscored the impact of cardiovascular disease on sexual function. He describes erectile dysfunction as the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. He explained that resisted blood flow to the penis tissues is a primary consequence of heart conditions, often leading to reduced libido, premature ejaculation, and even painful intercourse. Beyond the physiological factors, Dr. Eze also highlighted the physiological toll heart conditions can take. Anxiety, depression, and chronic stress, common among men with heart diseases, can further exacerbate sexual dysfunction. However, he reassured that many of these issues are treatable with the right medical interventions and lifestyle adjustments. In corroborating this viewpoint, Dr. Apo Edewo, a senior registrar in urology at the Lagos State University Teaching Hospital, stressed that erectile dysfunction can be an early warning sign of an underlying health condition, urging men to seek timely medical evaluation. He further identified diabetes as another major contributor to erectile dysfunction, explaining that the disease can inflict damage on blood vessels and nerves critical to erectile function. Dr. Edewo advised men, particularly those with cardiovascular conditions and diabetes, to actively manage their health through regular exercise, a heart-friendly diet, and smoking cessation. He reinforced that recognizing and addressing sexual dysfunction early can lead to more effective treatment and improve overall well-being. As medical experts continue to emphasize, erectile dysfunction is more than just a private concern. It can be a vital indicator of broader health issues. Men experiencing persistent sexual difficulties are encouraged to consult healthcare professionals, as addressing these symptoms early can pave the way for better cardiovascular and overall health. Next, in a significant development at the University College Hospital, UCH in Ibadan, resident doctors under the aegis of the Association of Resident Doctors, ARD, have commenced an indefinite strike. This strike follows a prolonged power crisis at UCH, during which the Ibadan Electricity Distributor Company only recently reconnected the hospital after more than 100 days of blackout. A recent investigative report by a printed media exposed the dire consequences of the outage, highlighting how doctors were forced to attend to patients using torchlights, an alarming situation that reportedly led to preventable patient deaths and significantly harmed medical service delivery. Prior to the strike, the IRD had issued a communique stating that its members would down to its full electricity supply was not restored by 4 p.m. on Monday. While the hospital's management has made efforts to reconnect some sections of the residential quarters, others remain in darkness, promoting the doctors to move forward with their planned industrial action. Dr. Adedeji reiterated the association's stance, emphasizing that uninterrupted electricity in all residential quarters is non-negotiable. He acknowledged the hospital management's attempts to resolve the crisis, but stressed that further action is required to ensure the well-being of healthcare professionals and the seamless delivery of medical services. The ARD has assured stakeholders that it will continue to assess the situation and engage relevant authorities until a lasting solution is achieved. Next, the 10th National Assembly is forging ahead with proposal to establish over 60 new national hospitals and federal medical centers across the country. However, this ambitious expansion drive comes at a time when existing institutions are grappling with chronic underfunding, manpower shortages, and deteriorating infrastructure. Nigeria currently operates approximately 20 teaching hospitals and 22 federal medical centers, including the National Hospital in Abuja. Yet, rather than prioritizing the revitalization of these struggling institutions, lawmakers are aggressively pushing for the creation of new ones. In just the past few months, several bills have advanced in both legislative chambers. The House of Representatives recently approved the second reading of a bill for a federal medical center, FMC, in Nasarawa State. Meanwhile, the Senate has moved forward with the legislation to establish another FMC in Kafanchan, Kaduna State. Additionally, proposals have been tabled for medical centers in Ekiti, Delta, Enugu, and various other locations nationwide. Notably, a bill for FMC Okigwe has already received presidential assent. While these developments may appear to signal progress, experts and industry analysts have raised red flags, questioning the financial and logistical viability of these projects. Critics argue that, rather than a genuine commitment to strengthening healthcare, these initiatives may be more about political posturing and securing constituency projects. Nigeria's health sector is currently in crisis. Medical professionals are leaving the country in droves, seeking better opportunities abroad, a phenomenon commonly referred to a brain drain. Teaching hospitals are struggling to cope, with chief medical directors recently sounding the alarm over worsening conditions during budget defense sections before the House Committee on Healthcare Institutions. Operational costs, particularly the rising cost of electricity, have further exacerbated the problem. A striking example is the University College Hospital, UCH, in Ibadan, which recently suffered power disconnection due to unpaid bills. In response to the surge in legislative proposals, the Minister of Health, Professor Mohammed Pati, has issued a stern warning. Addressing lawmakers at a public hearing on 16 new health facility bills, PET, represented by Dr. Jimo Salahuddin, cautioned against the proliferation of medical institutions in the face of dwindling resources. The government, he emphasized, is focused on cost-cutting and consolidation rather than expansion. As the debate continues, the fundamental questions remains. Is the push for more federal medical centers a well-thought-out strategy for improving Nigeria's healthcare system? Or is it a mislocation of resources that could further strain an already fragile sector? Well, we will continue to monitor developments closely. Next, health specialists, including pediatrics ophthalmologists and pediatricians, warn that the increasing prevalence of screen exposure among young children is following a surge in vision-related disorders, notably myopia or nearsightedness. Myopia, a condition where distant objects appear blurry while close objects remain clear, is becoming alarmingly common in children, especially in regions where screen use is extensive. According to the Cleveland Clinic, symptoms of myopia include blurred distant vision, frequent headache, eye strain, and the tendency to squint. Experts caution that if left unaddressed, myopia can progress rapidly, increasing the risk of severe complications such as a retinal detachment and glaucoma. Medical professionals have also linked excessive screen exposure to computer vision syndrome, a condition once predominantly seen in adults but now increasingly diagnosed in children. Symptoms include dry eyes, eye strain, headaches, and blurred vision, all consequences of prolonged engagement with digital screens. Beyond the eyes, physicians are raising the alarm over broader developmental and mental health concerns. Professor John Okeniyi, a leading consultant pediatrician and chief medical director at the Obafemi Awolowo University Teaching Hospital, emphasized that excessive screen time is contributing to cognitive and motor skill delays, obesity, and mental health disorders in children. Citing a study published in JAMA Pediatrics, Professor Okeniyi highlighted that children who spend extended periods on screen perform worse in key developmental areas, including communications, problem-solving, motor coordination. Additionally, excessive screen exposure has been associated with attention deficits, hyperactivities, and reduced academic performance. Another worrying trend is the link between prolonged screen time and childhood obesity. This sedentary nature of screen-based activities, often coupled with unhealthy eating habits, is driving weight gain and reduced physical activities in young populations. Furthermore, exposure to screens before bedtime disrupts sleeping patterns by suppressing melatonin production, making it harder for children to fall and stay asleep. On the mental health front, experts are warning of increased cases of anxiety, depression, and social isolation among children heavily engaged in digital media. Professor Okeniyi stressed that social media in particular is exacerbating issues of self-esteem, loneliness, and even cyberbullying, factors that can lead to emotional distress and, in extreme cases, suicidal thoughts. Pediatric ophthalmologist Dr. Sarat Bamus also weighed in on the risk of excessive screen exposure, stressing that children's eyes are still in a crucial phase of development and require natural environmental stimuli for proper growth. She emphasized that infants under 1 year should have zero screen time, while children aged 2 to 4 should not exceed 1 hour per day, as recommended by the World Health Organization. To mitigate these risks, experts urge parents to enforce screen time limits and adopt preventive measures and strategies. This includes promoting outdoor play to counteract sedentary screen habits, ensuring that children's screen time is primarily spent on age-appropriate educational materials rather than passive entertainment, demonstrating healthy screen habits by engaging in screen-free activities with children. Additionally, routine eye examinations are crucial for early detection of myopia and other vision problems. Dr. Badmus warns that undiagnosed visual impairment can lead to long-term complications, including glaucoma, retinal detachment, and myopic maculopathy. As digital technology becomes an integral part of education and entertainment, complete avoidance of screens may be unrealistic. However, medical professionals urge a balanced approach, advocating for structured screen time, increasing physical activity, and stronger parental oversight to safeguard children's health and development. As the debate on screen time intensifies, one thing remains clear: moderation is the key. The future of our children's visions, cognitions, and mental well-being depends on how we navigate this digital era. Finally, senior public health and nutrition experts have raised alarms over the dangers of consuming food exposed to flies, warning that such exposure dramatically increases the risk of foodborne infections and diseases. According to the World Health Organization, which is the WHO, unsafe food leads to an estimated 600 million cases of foodborne disease annually, resulting to 420,000 deaths worldwide. Even more alarming, 30% of these fatalities occur in children under the age of 5, underscoring the urgent need for preventive actions. Public health physician Professor Tanimola Akinde of the University of Ilorin explains that flies are mechanical carriers of germs, transforming pathogens from contaminated environments directly onto food. These insects filtered in surroundings such as garbage dumps, sewage, and decaying matter, bringing harmful microorganisms with them wherever they land. Professor Akinde warns that foodborne diseases linked to fly contamination includes 1. Diarrheal diseases such as cholera, typhoid, and dysentery. 2. Parasitic infections such as intestinal worms, 3. Poliomyelitis and others. Such infections can range from mild discomfort to severe illnesses, and in some cases, they may even prove fatal, particularly for vulnerable populations such as young children. Adding to these concerns, Professor Wasio Afolabi, a renowned expert in community nutrition from the Federal University of Agriculture, Abeokuta, highlights another critical aspect: nutritional loss. He explains that food exposed to flies does not just carry pathogens, but also loses its nutritional values. Instead of nourishing the body, contaminated food can lead to malnutrition, dehydration, and nutrient depletion, especially in cases where diarrhea ensues. To mitigate these risks, experts emphasize the importance of 1. Covering food properly to prevent fly contamination. 2. Ensuring proper hygiene in food preparation and storage. 3. Washing fresh products thoroughly before consumption, making sure that very neat, be it fruits or vegetables. Cooking food at adequate temperatures to eliminate harmful microorganisms, and so many other things. Well, public health advocates also urge food vendors and marketplaces to adopt stricter hygiene measures, including the use of ventilated coverings to protect food from exposure. The message is clear. Consuming food exposed to flies is a silent but significant threat to public health. By practicing proper hygiene and ensuring food safety measures, we can reduce the risks of foodborne diseases and safeguard our well-being. Stay informed, stay safe, and remember, what you don't see on your food could harm you most. Well, this is all we have for you for today. Stay tuned for more insightful discussion on your health and your well-being, popularly known as Your Health and Your Wealth. And don't forget to like, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more updates. Until next time, I remain Nenyer Michaeline Izini. Bye for now.